Welcome back. Welcome back. It gives me great pleasure. Hello. So it gives me great pleasure to introduce to you all Dr. Ruth Zambrana. Dr. Ruth Zambrana is a professor in the Department of Women's Studies, and she's the director of the Consortium on Race, Gender, and Ethnicity, a professor also in family medicine at the University of Maryland, Baltimore School of Medicine. So, Dr. Zambrana.
Good morning. Buenos días. Esteemed faculty, administrators, trainees, and students. I'm really delighted to be here. I wish to thank Dr. Harlan Belcher for the invitation and the opportunity to engage in a conversation with you about central issues in the education and workforce development diversity discourse. My talk today focuses on the group who are primarily absent in the diversity discourse, which is Mexican Americans, population whom we as a nation are less comfortable in discussing, who are defined as historically an underrepresented group, and who are also defined as socially and economically disadvantaged groups. I have no conflict of interest disclosure, but I do have a disclosure. Disclosure is that I have in my heart this topic that I treat with passion, commitment, and advocacy. And I come out to hopefully inform others and develop new advocates. Let me say a little about my background. I come out of psychology, and then I went into social work to try to help people. Then I went into sociology to try to document the lack of information that existed around low-income groups, African Americans, Puerto Ricans, Mexican Americans. My most recent group that I've learned about is Native Americans, whom I didn't have access to at that time. And then I did a postdoc in community medicine, trying to figure out what are the solutions. And this was back, I don't want to tell you back when, this was way back, trying to figure out with community medicine what we can do to change the lives of the people in these communities and to improve our interventions in medicine, in education, and in other areas. So today, my aim is to have a conversation in which we can examine this long-standing problem of underperformance in schools that has been referred to as the leaky pipeline, to interrogate the myth of progress, and to look at solutions that mark successful pathways from K-20 to beyond. Equally important, I want to promote a challenging discourse on what each and every one of you can do to move towards equity in our society and educational institutions. I want to thank the former speakers. I think they laid the groundwork. We now know the problems. We know what families experience. We have learned that education is a major social determinant. Education is everything in terms of access. We learned that higher income families have more diagnoses for children with disabilities and with autism and with every chronic condition. Why? By the way, I want this to be more interactive. I want all of you to participate as we go along, because I think this topic, we are now shifting from the problems that people have, which is so much more comfortable for all of us, to what are the institutional, cultural resistances to engaging in solutions, to implementing solutions, because these problems are not new. I worked with an autistic child at Roosevelt Children and Youth Program a long, long time ago. That child got better for some of the reasons that our presenters have already mentioned. I was there with him. I worked with the mother. I was consistent. He had access to all of the services. So we know. Yet these are hard topics because we oftentimes feel powerless in terms of change. But all of you here at Johns Hopkins University can ask yourself, what is this institution doing to make the lives of these individuals better? The nurse said you have to see 4 patients an hour. Well, at what point then do you help the patient to understand what are the resources they need? So this topic is different because it does 2 things. It will shift to looking at the institutions and institutional culture and actual data, and it will engage at the end in translational science. So my presentation is in 3 parts. First, it's important to examine the language that we use when we inform others on programs and communicate progress. Who are we talking about? And I like that the presenters finally broke it down by SES and race and ethnicity so we can see where the needs are. We can see where the problems are. What types of supports are needed? Who requires the most support, and why is this important? Secondly, I want to provide an overview of the educational troubles we have in our nation as a student progresses through the academic pipeline. I'm talking and I'm going to forget to change. Okay. And in this, for each of these issues that we discuss, we have to have a context. And in this context, we have to look at student debt. We have to look at family wealth when we look at educational progression. And third, I really want to inform you on some remarkable evidence-based and common sense programs. Common sense, and I use the word common sense because I think we have lost it in the United States, is if people are hungry, they need food. I mean, we're talking here very basic. And we don't need 10 PhDs to figure this out, or 5 PhDs and 5 MDs, and maybe, 5 more doctors of nursing. We know what to do. The question always is, why aren't we doing it? So I want to go over some programs that are evidence-based and that have worked for many of our students throughout the nation. So to interrogate the politics of knowledge that inform equity and progress, particularly diversity is something that we want to look at. Data is always important because few people can believe that there are some areas in the United States where we have a 60% high school dropout rate. So we're going to look how data are used and what they tell us and what they don't tell us. Because one of the lessons I want all of you to learn and to think about is when you're looking at data, what does it tell us? Are there pieces here that it does not tell us? And that's equally important. We want to discuss the challenges of achieving equity. This young woman talked about the school, the question, the public schools in the United States, that she doesn't have resources. I was talking to a young social worker last night who was assigned to a school in Philadelphia with a lot of tension, and there are no resources for her to begin to develop groups, to begin to bring in materials, to begin to work with these children around conflict resolution. So why don't they have the resources? Should be our question. We have a lot of resources in this country. And then the programs. Now here is a word cloud, and I have for you, what do you think about when the word equity is mentioned? Word clouds are important because they're a visual reflection of our cognitive map that may inform implicit biases. So can people tell me what they think about when the word equity comes before them? You can just shout it out. I can't hear. Yes? What did you say? I heard someone speak. Oh, back there? What did you say? Opportunity. And the first one said fairness. What else? Fairness, opportunity. Services. Rights. Rights to what? Rights to what? I don't know who said rights, but rights to equal treatment. Rights to what? Right to have their needs met. Rights to access. Responsibilities of systems. Yes? Quality health care. Okay, so we think about a lot of things when we think about equity. The other side, you're all talking about the positive side. Where is equity needed? Equity is needed for the disadvantaged. Equity is needed for racial and ethnic groups in this country. So equity is needed in many, many areas. Opportunity, economics, income. Now, when we talk about equity and diversity in this country, we have what I call a discourse of discontent. This discourse of discontent is very hard to talk about because arguments can be made and are made for almost every subgroup in this nation of some disadvantage. And the arguments are valid. Are they not? We have a homophobic society. We have LGBT groups who are discriminated against in many, many different ways, religiously, etc. We have disabled groups. We have racial and ethnic groups. We have immigrant groups. We have religious groups. That's everyone. We can make an argument for everyone. So it's very difficult to talk about the historically underrepresented groups. It's very difficult to talk about history. Now, when we talk about intersectionality, the reason that this construct is so important is because it brings in history. It brings in those groups that challenge the notion that we are an immigrant nation. It challenged the notion that people of African origins were brought here and enslaved, that Mexican Americans, the northern part of Mexico, which includes California, Texas, Arizona, New Mexico, and Colorado, are really northern Mexico. And that those states, those peoples in those areas have been here for 15, 16, 17 generations. And we still use an acculturation scale on them. Anyway, neither here nor there. We're talking about Native Americans, who are the First Nation, as they call them in Canada. We are talking about Puerto Ricans, who now we see the disaster of colonialism, so who were incorporated into the United States in 1898. So those groups, when you look at the data, when you disaggregate the data, you see that they are the most disadvantaged. But we really can talk about who is the most disadvantaged because we're always talking about equality and not equity. So what's the difference between equality and equity? Does anyone know? You have to speak loud. Right. Exactly. Does everyone understand that difference? So equality assumes a level playing field. So you and you and you and I have the same amount of money, have the same amount of education, so they're going to treat us the same. But it may be that the first person comes from a low-income family. You know, that the second person does not have the same quality of education. Maybe one went to Harvard and one went to, I don't know, University of Maryland. And so it's not the same, you know, in terms of prestige. So equality doesn't really help those who are the most disadvantaged. So I think it's important to remember that. But in here, the United States, we hardly ever talk about equity. We talk about equality. So the other thing that's really important, and I'm sure all of you have experienced this, is this institutional resistance to engage in self-reflexivity on snail-like progress. So whenever you discuss, well, there's a myth of progress, and when you look at the data, there is a myth of progress, what do people say? Oh, but, 50 years ago, we didn't have that building over there. Or 50 years ago, we didn't have this number of grants. Or 50 years ago, people didn't have health insurance at all. Now some people have. So constantly, the snail-like progress is still seen as progress, even if it is not really helping people. And then definitions. How do we define? I just want to go over a few definitions because language is power. And I just heard a wonderful scholar in Colombia, South America, say words are never innocent. And it sort of went together with my language is power idea, that words are never innocent. So we have to constantly decipher the power of language. Well, things are getting better. Well, you have to have hope. Why are you a pessimist? All those things challenge you in terms of not looking at what doesn't work. The definitions of diversity, excellence, and equity are all over the place. You have millions of definitions for each of these terms, which then reflects the lack of ability to really reflect on what diversity is, what excellence is. What are the metrics to evaluate diversity? Does anyone know? Well, actually, there are none. I have reviewed over 180 studies, and we were unable to find who evaluates diversity. So how is diversity evaluated? It is a feeling. It is an observation. I look around here, and why is this? Because the definition of diversity is a biological one. And it is true that everyone in this room is diverse. Because everyone has a different life experience. Everyone has had different incidents in their life. So is that what we meant by diversity? There are no metrics to evaluate diversity except what institutions decide is diversity and that is convenient for them. So meaning matters both in development and implementation of everything we do, of our research. How does research get determined? Who sets the agenda for research? You don't, right? No, you don't. Okay. Who sets the agenda for research? Congress. Whose interests are reflected in those agendas? So I think it's important that we think about definitions matter, and I believe that ambiguous meanings, which is in most of these definitions, obscure racism and ethnocentrism and classism, and promote elitism. So we really have to look at the power of language and what is said and not said. We just say for diversity was a real backlash to affirmative action. Affirmative action was a way of trying to implement equity, of trying to level the playing field, of giving resources to those who historically had been denied education. Mexican Americans were not allowed to complete high school in Texas until the 1970s. So we are talking, I don't know, maybe you weren't born yet in 1970, but we are talking pretty recently. We're talking pretty recently. African Americans were denied education in the South. So it was not until the 1970s that historically underrepresented peoples were allowed to enter the ivory towers of the Ivy Leagues on the East Coast and the Northeast Coast. So we're talking history has really defined many of these groups. The other definition that I'm going to move on is first generation. Now, first generation was redefined from meaning your parents haven't graduated from high school to meaning your parents haven't graduated from college. Now, who do we have in here? We have people whose parents went to third grade with people whose parents went to the last semester at Harvard or Yale and didn't graduate. What happens in that competitive pool? Who's going to get the financial aid? who's going to get the entrance to the college as first generation? So is this a fair spectrum of competition? We're back to where we were before, right? For Mexican Americans, 58% of Mexican Americans' parents have not graduated. That's big. That is big. And it still exists. In the book Magic Key, which is the book I'm talking about today, we focus in on Mexican Americans as a highly disadvantaged group. So I think first generation is something that all of you, if you are on admissions committees, I beg you, please, look carefully at your pool, because the people who are still getting in on the first generation are the most advantaged in this nation. And therefore, we are not fulfilling, again, a goal of equity. And diversity has become to mean what it meant before. Elite, more upper middle class, predominantly white students. Now, we do have also an international student body, which is a very important talent pool. And as part of this diversity discourse, we have also decided to aggregate international people of color to assure the reproduction of the system in the United States. So we've just been economically and educationally disadvantaged, I think, is the important one we want to talk about here, which is the denial of equal access to educational opportunities, the tendency to leave education at the first opportunity, and the hindrance of achievement by social and environmental factors. And here again is where SES comes in, or education. What does education mean as a social determinant? It means you live in impoverished neighborhoods. It means you have less access to quality education. It means that within those educational systems, you have less access to any type of resources, be it educational, medical, or mental health. So education is a major key in determining access. I wanted to, most people don't know about the Hispanic population, so I just wanted to go over with you. Is it big enough? It's bigger. Hispanics. So when you look at the Mexican-born, about 32% are foreign-born. In looking at Latin Americans, Mexican Americans are the least likely to be foreign-born, except for the Spanish or other Hispanic. So yet when we think about immigrants, we only think about the Mexicans. So Argentinians, Bolivians, Costa Ricans, 50% foreign-born, 56% foreign-born, Venezuelan, 70% foreign-born, and Mexican Americans, 64% are U.S.-born. So in the United States, 64% of the Latino population, which is 17.6% of the nation, are Mexican, about 10% of Puerto Rican, 3.5% Cuban, and then we have about 25% Central and South American. In this area here, you have an interesting mix of Latinos. You have a small group of Puerto Rican professionals who migrated from the Northeast way back when. You have low-income Central Americans and some Mexican Americans. And you have a strong cadre of South Americans who are more professionals in this area. So you have a mix here of different folks. So the question becomes, why study Mexican Americans? And I think it's Mexican Americans who are representative of a large cadre of this historically underrepresented group. So they are the largest group. They have the longest history on American soil. And also we need to study them because we need to challenge the knowledge production around this group. For many, many years, many centuries, we have been saying that the Mexican Americans are not interested in education, as we say about the Puerto Ricans and other groups, and that their parents don't value education. But we know that's not true. All the data show that Mexican Americans value education. and that is the institutional response to their inclusion in the classroom. I don't know if all of you have read on zero tolerance policies. Who is more likely to have zero tolerance policies and to be suspended from school? African American, low income African American, and low income Latino students. Studies have already shown that you could have white students who engage in the same behaviors and they are not suspended. They could wear their pants down to their legs, to their thighs, and they are not suspended. So we have different forms of persistent institutional racism that constantly undermine the efforts or the resilience of many of these low-income racial and ethnic students. But we want to challenge knowledge production, because the most important thing here is to get out new data, to show that there is an interest in education, there is a passion for education, and that it is not the fault of that community or those groups, but it is that interaction between being low income and institutional racism. Another thing, it's important to disaggregate the data so that we can see where the problems are. Now, the U.S. Census Bureau currently is trying to do again what we fought for many, many decades not to do. Latinos come in many different colors. So the Dominicans tend to be, have significant black race. Puerto Ricans are mixed, about 40% are black, etc. So they want to combine now race and ethnicity, to go back to you're Hispanic, you're just a Hispanic. But race matters also in the Latino community. The more racialized you are, the more likely you are to experience discrimination, and the less likely you have access to resources. So we need to disaggregate the data, which was the original reason for disaggregating, to know where are the needs. How do we respond to needs if we don't know what they are? So data. Are the data telling, cannot see, represent a story of Latinos by race, ethnicity, and geographic location? So let's look at high school dropout rate. I'm just going to go through these quickly to give you a sense. I'm trying to make this bigger. So we see here that high school rates overall for Hispanics have increased. The African Americans have stayed pretty steady, and the Hispanics have increased over time. And they have been dropping again in 2010. Why do you think that is? Anyone take a guess? I'm sorry? Race to the top funding, which means?
Obama administration.
Why it dropped?
Obama administration is policies for education.
Okay. In what ways would that have contributed to the rates coming down, the high school dropout rates? Oh, because he has instituted good policies. Okay, like what? Can you give me an example? I'm going to need your, I can move this now. Harlan? How would that have affected it? Thank you. Yeah, okay. So we really don't know. We don't know if the data is inflated. We don't know who's being counted. So again, when you start to look at these things and you talk in different communities and you visit different communities and you look at Baltimore and you say, well, who was affected? Whose rates dropped? Was it the kids in Baltimore? You have pretty high high school dropout rates here, don't you? I know that in Prince George's County, they have just come to us where they say Latinos, it's about 50 to 60% dropout rate in Prince George's County. So again, what I'm trying to show with these data is that you always have to interrogate, what does this mean? Who's being affected? Is it real? So here, high school graduation rates by state. So in Texas, 84%, which means that 16% drop out. Yet, what happened in Texas? Who do they count for high school graduation rates? Do they count those who dropped out in the 7th grade, 8th grade, 9th grade, 10th grade? Do they count only the ones who dropped out in the 4th year of high school? They only count those who dropped out somewhere between 3rd and 4th year. So they're missing 7th, 8th, 9th. We know that low-income kids tend to drop out of school somewhere around the 8th or 9th grade. The 13, 14, they can work at that point to help support their families. Or because we also know that a good portion, about 1/3 of low-income kids, are 2 grades below reading level by the 8th or 9th grade. So they tend to drop out. Okay, so again, we need to understand sort of the context, the socioeconomic status context, the neighborhood context, the school, the institutional policies, the racism in the schools, to really understand and ask ourselves, what are these data really saying? Colorado, 65% graduate. So we could imagine it's even less than that. New York, 63% graduate from high school. So we have an educational problem. We compare to the Asians, the whites, and even for the African Americans. Florida, 64%, 63%. We have a problem in terms of high school graduation rates. And is it the people? I love to ask my students, is it because these kids are dumb? Or is there something else that's happening? So we have to look at institutional policy. We have to look at racism. You call it whatever you want. Racism, implicit bias, I don't know how many other terms we've called it. It has to do with institutional culture that is not promoting resiliency in these kids, because they do have a lot of issues coming from their neighborhoods, as our speakers have already told us. Trauma, witnessing killings, all kinds of things occurs in their neighborhood. It could be food, nutrition. They come to school hungry. It could be a mental health. The parents are mentally ill. The parents have physical illness, cannot take care of them. And there are no other individuals to help them. So there are many, many issues that are going on that affect the lives of these children. And there are very few resources in the schools. So here we have Latinos who attended some college or earned an associate degree. The ones most likely to earn a degree are other Hispanic. So other Hispanic are who? They're people of, they're Spaniards, they're New Mexicans. So they tend to be more of the, have higher SES. Then you have the South Americans. South Americans tend to have higher SES than other groups because we had a brain drain in the 70s, the 1970s, 80s, and 90s. So the point I want to make with this chart, you need to know who you are speaking with in your practice. And if you're a nurse, you're a technician, you're a physician, you need to find out who this person is, where they come from, what is their background. Are they U.S. born? I mean, how many U.S. born Latinos who've been here for 5, 6, 7 generations, you ask, do you speak English? Or where are you from? Well, I'm from New York. Okay, so you need to know, because there are many different Latino groups with different class status, with different racial status, with different political background. I think that's important for us to know. And you see that the Mexicans here, again, are really not doing so well. And Central Americans are close. And again, when you look at the Central American community, it is also both an elite community and a low-income community, because different groups came after the U.S. intervention in El Salvador in the 1970s and 80s. You had a professional group and you had a low-income group. So there's a mixed set of data there. Bachelor's degrees. U.S. Hispanic Latinos, it's about 9%. have a biological, biomedical science, 14% psychology, and about 13.3% in social science. Only about 10% of all Mexican Americans have a bachelor's degree, per se. So they are the lowest of all the Latino subgroups. Doctoral degrees. When you look at the larger data set, this is for the different groups. It's 4.5% doctoral degrees, 7.8% for psychology, and STEM is 5.7%. Again, very low compared to the larger group of people. So for every student who graduates from high school, only one ends up with some type of doctoral degree. Student debt. Students are, and we hear about this all the time, the amount of student loan debt. Hispanics are the least likely to incur debt for fear of incurring it because they simply don't have the credit to incur it. They are not encouraged to do it, and there is no money for them to really go to school. Many of our students at Maryland and throughout the United States work 2 and 3 jobs while they come to school. So it is very difficult either to get the loan, fear of paying back the loan, and lack of knowledge of how to get loans. So those 3 things exist more so for that group. Now, I thought it was important when we look at education, we also have to look at wealth. We have to look at family wealth. Because one of the issues that's coming out over and over is that many individuals from middle-class families can help their children to go to school, can pay for their education. They don't have to work. But when you look at the racial ethnic wealth gap, you see the tremendous lack of resources. Latinos and Black families have the lowest levels of work. Yes?
How does family define instantly?
This family is usually mother, father, and 2 children.
So not really including...
No. That's a very good question. So it's what your family has at the moment, right? So this impacts clearly education and educational attainment, because education is usually an intergenerational thing, which is what you're pointing. Now, the other important point as we look at this is the impact of the Great Recession on family wealth. That's why those data on suddenly high school dropout rate going down contradicts these data. The Great Recession impacted Latino families the most. 86%, minus 86%. Now, why is the impact so great on Latinos and African Americans? Yes. They live in neighborhoods that already have lower assets in terms of housing, right? So when the Great Recession came, Prince George's County lost 50 to 80% of its value. I live in Montgomery County. I lost like 15 to 20%. So the impact of education of throughout your life course impacts you at every step of the way. Who lost their jobs? Who lost their benefits? Low income, working class, middle income folks. So the impact on them was tremendous, as it was on African Americans. I just wanted to show you, I decided at the last moment to put in something on MDs. I couldn't find nurses at the moment, but about 5.5% of MDs are Hispanic Latino. And of these, Mexican Americans are 35%, Puerto Ricans are 34%, and other Hispanics, which are mainly South Americans and Central Americans, are physicians. So out of the 5.5%, it is one-third, one-third, one-third. What happens with workforce development in the United States? How do we begin? How can these individuals who come from low-income families, 57% of their parents are non-high school graduates, who have very little social capital in terms of negotiating the systems, in terms of understanding the systems, and who come from schools that are poor quality, begin to penetrate into the health professions? How do you think we can get some equity around this? Nursing. Nursing, Hispanic nurses are 4%. Has anyone ever thought about this? I don't know. Have you? Maybe you haven't. No.
I feel like it's a thing that we all are taking responsibility where we can, and seeing ourselves as leaders, as well as when we are in a position of leadership in terms of hierarchically in an organization, seeing this as a place of focus, and where we can resources, financially, and people along the pipeline, and then recruiting institutions, focusing also on retaining, making sure people feel socially included. I think multifaceted, is like,
Mm-hmm.
I'm not very,
You're not ready to what?
not all raising my hand, so many
Mm-hmm. That's a good point. Okay. But, okay. Well, we'll come back to that. Thank you. Oh, go ahead.
HR perspective, I do know that for faculty, there is a lot of efforts going into now for that. There is a certain level of
Okay. Thank you. Well, I've just spent 10 years studying historically underrepresented faculty. And we have seen a decrease in African American faculty over the last 10 years. They're 5% now of all universities. Now, all universities, we're talking about 4,000 accredited universities in the United States. So the data are for the large. Mexican American is 1.2% of all faculty in these universities. And Puerto Ricans is 0.6%. Now, other Hispanic is 2.2%, which is essentially the brain drain from South America. So we have not seen, when we look at the data, any real increase, rather a decrease in diversity across the universities. Now we can see that there are international faculty. So we don't know when that came into the definition of diversity, when diversity was really a very political and intentional inclusion of leveling the playing field for historically underrepresented groups. Now, that is another study that I have done, and I'll talk a little bit at lunchtime about that. So how do institutions become more responsive to understanding the importance of inclusion of the domestic talent pool, so to speak? And I do think, and the literature has spoken to this, it's very easy now for institutions to incorporate international faculty who tend to be the elite from their institutions. So there's a match in terms of class, there's a match in terms of social capital, and there's a match in terms of political ideology. So the status quo is maintained, if I may present this perspective. The status quo is maintained of an elite university with individuals who don't have a social justice agenda or an agenda that focuses on the social problems in our communities. So again, this is something that we really need to interrogate as a nation. Are we going to continue to exclude, under different guises, those very people who were here before, who are the foundation of the United States? So I think these are critical, questions, and that's why they're difficult to talk about. But can we do both? I mean, I think we need to look, there's a wonderful international talent pool here. There is a all-American talent pool here, and there is a historically underrepresented talent pool. And there is another group, a refugee group, that United States has reached out for humanitarian reasons. So when I looked at the data, the Vietnamese, there are 3.3% of the medical school faculty. Well, there's another refugee, group that's really important also. So how are we able to talk about the different talent pools? Because diversity is very comfortable, because it doesn't mean anything. So it's very comfortable, because we don't have to make a commitment to anybody, to nobody whatsoever. We say diversity. So these are really, I'm talking about the Mexican Americans because they're such an important part of our history. This is part of their country. And we continue to malalign them as immigrants only. And 70% are U.S. born and have been here for a long time. Now let me I found this very interesting thing also. So again, what we see here for Hispanic physicians is a downturn, again, starting in the 2000s. So we're seeing a downturn. And the downturn comes really with this diversity push for people outside the United States. Now, I found this. Where are the physicians graduating from? And Lord and behold, they're graduating from the University of Puerto Rico, which has a fabulous medical school, fully accredited, Caribe, and Ponce. These three things are in Puerto Rico. So more than half of the Puerto Rican physicians, and I assume some of them are Mexican and from other Latin countries, are graduating from non-U.S. medical schools. So I asked myself why. I was actually quite shocked here. There was an article in the Washington Post last year by Mary Beth Gasman from University of Pennsylvania. And did anyone of you see it? The title of the article was, "Why don't we have URMs? Because we don't want them." And that caused a whole long thing. But one has to think about, why is she saying this? And what does this mean? And why don't you want URM? Now, part of it is this intersection of our definitions of excellence, diversity, and equity. So what does excellence mean? Can someone tell me? I haven't found a definition exactly except in Webster's. What does excellence mean? It means superior, right? It means very good. How do you get to excellence? How do you get to excellence? Excuse me? Practice and training, yes. But prior to that, How do you get to practice and training? Studying. Money. Support. Being able to what? Being able to do what others want. Won't. Right. Okay, yes, that's very good. Vision. Feelings of belongingness. All right. Excellent. Okay. I think it means all those things. What is not taken into account is how do you get this? If your parents can put you in a private school, if your parents read to you every day, we say that. Someone said if you're not read to by the 3rd grade, you're doomed. Having access to after-school programs, having access to tutoring, having access to summer camps, all these things, you develop. All superiority excellence develops over time through the investment of individuals around you, through the investment of institutions around you. I have been always surprised. For example, who are the people who serve as the staff for Congress? The children are the friends of the congressman, okay? I know that for a fact, actually. The children are the friends of the congressman. Why? Not only is it the social contact, because you have to have access to a social contact, but when you finish college or while you're in college, for many low-income kids, their summer is about working to save money to help their families. For these kids, they can volunteer because their parents help them. So these are all things. What is the development of social capital, and what does it mean, and how does it help you? And these are all things that feed into excellence. And these are the supports we need to provide to these kids as they come through the system, be it in the school systems, where they need resources, some for disability, but others just because they need to develop social capital. And social capital is the social competence we talked about. That doesn't come out of nowhere. That is taught. It is connecting you with the right people. It is having a mentor. That's the lunch presentation. The mentor that is so critical. In my study of 600 URMs, mentoring, someone you could trust was really, really important. Someone who taught you the rules, who taught you how to act, was really, really important. So the challenges to achieving equity. There's a wonderful article that just came out on Monday. Brian Letter talked about academic ethics. Is diversity the best reason for affirmative action? And he talked about challenges to achieving equity. One challenge is that if we want to ensure the education of the elite, it's very hard to bring in people who are low income. Assuring the flow of alumni dollars. That's very important, as many of you know, in many of these universities. Now, if the alumni don't have sons who are superior or daughters, they still get in, but that's because it goes with the dollars. Diversify. Gender, and now especially race and certain ethnicities. So there's a whole move now to diversify differently. The advanced program for the National Science Foundation, how to push women into leadership positions, has become an important area. Keep moving and breaking ceilings, but the majority of those women are not racial and ethnic. Rankings becomes a predictor or indicator of excellence. And those ranking issues mask these three important goals that institutions have. We continue to use the words diversity, and human resources uses it a lot, but what are the measures for accountability of really influencing diversity? Or what are the clear indicators of success that we have achieved diversity? No one has written about that yet. And the other thing, there are works now, about 50% of Hispanics attend Hispanic serving institutions, and a large number of African Americans, there are over 200 HBCUs in this country, attend HBCUs. So what's the issue with that? Is there an issue? Right. That's very important, because some people get a job just because they go to a certain university. I don't even look at their transcript. So prestige is really important. What's the other really, really important thing? You've mentioned it over and over. Resources. They are underfunded. They are under-resourced. I remember about 15, 20 years ago talking to a group of HBCU faculty about how to write a grant, how to look things up, and they kept saying, not everyone has a computer. Could you imagine? In those of us who are in research ones, not everyone has a computer. You go to the public schools of K to 12 high school, not every community has computers for their kids. Not every community has libraries with computers for their kids. And HBCUs and HSIs don't have the types of resources that contribute, that can push the type of excellence that is now required in this society. So it is a very, it is a big dilemma in terms of equity in the United States. So let's just, so here, I love this little chart. Where's that little thing? I can't. You see, equality, you don't have it. Yeah. Figure it out. I can't, oh, here we go. No? So equity, you see this? Here's equity. You give a push, you give a lift. And here's equality. So if you have equality, you see this little guy down here? He can't see. He really can't advance very much. So what are the ways that we can give that extra lift so that we can assure that we all have an opportunity to access excellence? And that's what equity is. The opportunity to access excellence. Not everyone's going to take advantage of it, but it will be an opportunity. So one is the new idea of holistic admission, which is the emphasis on the whole person. And that contribute to the academic community in meaningful ways. So their experiences, attributes, and academia. So oftentimes, important things in admissions several years ago was doing a study abroad or, traveling internationally. Well, that was a little bit elitist, wasn't it? Because not everyone can do that. So now we have other types of contributions. Well, maybe if this kid has worked 3 jobs throughout his entire high school and then also got an A- average, that matters. That matters. The other one is no cutoff for standardized testing or grade point averages. We have known for years now that the SAT do not predict necessarily success. So this was another opportunity to take this into account. If a person is really good, maybe that standardized test doesn't matter. And then they're evaluated within the context of their high school's most challenging academic programs. So many of these high schools actually don't even have challenging programs, but some do. So take that into account. And again, what it is taking into account different measures, not just a set of elite measures. High school seniors, Summer Academy for Mathematics and Science. These are 6-week programs for high school seniors with strong interest in STEM fields. So the recruitment, the trick always becomes the recruitment of the underrepresented. I know that Hopkins has a whole bunch of summer programs, but they have to be free. We can't be charging for them. Hopkins programs are expensive. I know someone who came here. So I don't know how many scholarships they have, but we need to be able to take into account that these kids come from low-income homes, and we have to make sure they are the kids that really need it. A recent study shows that 70 to 80% of those who get financial aid don't need it. That makes sense. And these are need-based. We understand the merit scholarships, but need-based. And what happens there? What happens there? Well, if kids declare themselves independent, even if their parents are wealthy, parents do not have to report, by the way, savings, IRAs, retirement benefits, or anything for financial aid. They have to report their income and savings. So 80% of kids are getting financial aid, they don't need it. But you know what that means? That those who need it are excluded. And they may be excluded for a number of reasons. They don't know how to do the application. They don't even know you have to do an application. Their parents didn't save those records. Their parents don't work, so there's nothing to report. I mean, there are a million reasons why they do not get into the pool. But how do we make sure? How do we go out there and say, we're really looking for kids, historically underrepresented kids who come from African American parents or Mexican, or you have here some Salvadorian kids who've been here a long time. How do you go out and get them? People never ask who you are. If you look Hispanic, I guess I don't look Hispanic, they tell me, so I would never get into the pool. But they look at you or they assume. You need to go out and recruit and really find out who these people are. And for all of you who are going to be service providers, you need to do the same. We need to give them full financial support. We need to give them credit-bearing courses for that. So one of the things recently the Chronicle of Higher Education talked about is that the research experience in the undergraduate degree is critically important to future graduate work, etc. We have at Maryland, and many universities have, research experiences. You work with the professor. But you don't pay them. They volunteer. This notion of volunteer got to go, because low-income kids cannot volunteer. So what about, I'm trying to figure out, how do I get research paid internships, also with credit? I mean, it would be a class. So you're grading them, you're teaching them skills, you're transferring skills, etc. So for those of you who want to help someone, a high school senior, or even an incoming URM, you can ask them. Now, don't offer to pay a rich one, but they have to be poor, who they would be working outside, but they would, instead of working outside in Starbucks or McDonald's, you can provide the internship plus, a reasonable amount of pay for that. So we pay $12 an hour for undergraduates. That's much more, I believe, than Starbucks or McDonald's. You would also provide credit, and you would be engaged in a mentoring experience. And that is the other thing, that is a big difference between many URMs and non-URMs. They do not have that basic experience that many middle-class and upper-middle-class people have. They have a Xerox machine at home. They have a scanner at home. They don't have those skills. So the mentoring and the patience and development of skills is really important. So I have three young people now from the Incentive Award Program, which is a program that takes the top kids from Baltimore into the University of Maryland and provides them free tuition and free board. So, but they don't give them books, and they don't give them a stipend. So many of these kids still have to work to support their families and to help their families to survive. So I decided I'm going to do a small research internship for them. I cannot pay them this semester because I'm looking for money, but I'm going to at least begin the training with them. So what am I doing? First, I do a professional's do's and don'ts. I sit them down. This is our first session. Scare them to death. Professional do's and don'ts. How to talk, how to dress, how to come in, how to say good morning, how to leave, tell me when you're leaving. So we go through this thing. So that's number one. Number two, the types of tasks, and ask them what they know, what they don't know. And then we meet every 2 weeks. What are the questions? What did they learn? What didn't they learn? So it's a constant interaction with them. Because I understand now more than ever that no matter what, if I can train them professionally, how to speak up, how to speak loud, how not to mumble, all those things. And you know why I can do this? Why can I do this? I'm Latina, no, more. That's not the only qualification. I'm a role model. The most important thing is I do care. And they pick it up. I care. And I have told people things, and they were furious with me, and then they called me a year later and said, thank you. Thank you. You were absolutely right. No one has ever talked to me that way. If you care, you can connect with these young people and make a difference in their lives and transfer the social capital that they so desperately need. So do you understand what social capital is? Yes? It is how to act and how to navigate in a white dominant society that focuses on excellence and all kinds of other values that are important in order for our nation to move forward. How to collaborate, how to work together, all these things matter. Okay, so for high school seniors, there's a lot you can do. And any of you who can, or the university can set up a program for high school seniors. Now, the important thing is not to pick the diamonds out. You pick the diamonds in the rough, because those are the ones who need you. The diamonds are going to survive. They're going to do well. You know, all those resilient diamonds, they will do okay. But it's the diamonds in the rough. How do we go into places and pick those out? So the other areas that have been looked at for programs is community colleges and first year. Again, these bridging programs are really important. Helping people through those community colleges. We're now trying to look at community colleges as those counselors and say to them, how can you prepare the students for the 4 years, or the transition to the 4-year college? Oftentimes, students are not well counseled in the 2 years. They don't understand how to navigate this. While many upper middle class kids go to community colleges to save money, and they know how to navigate. They're talking to the 4-year college. They're talking to the 2-year counselors. They're reading the stuff. Their parents are reading the stuff so that they come out, you know, well prepared to transition to the next educational program. And here is the Maryland Incentive Program. It is one where we do faculty mentorship. We do psychosocial support. And I have my little success story of my young girl, Dawn, who I got when she started sophomore year. I groomed her. I helped her with writing skills. I gave her confidence. She's a graduate of the University of Pennsylvania, and she's doing very well. So I have many stories like that, but this young woman came out of the Incentive Award Program. Now, the same thing with faculty. How many are faculty in here? You look so. 1, 2. Okay, 3. So these things, just bring it up a notch, apply to faculty too. Oftentimes, they do not know how to navigate the world of academia. And as we mentor them, we also have to be able to help them with the rules, the unwritten rules, etc. The other thing is money. There is a wealth gap. So we should not be asking any faculty, but particularly underrepresented faculty, to make large investments without some monetary compensation, because we should be aware of the wealth gap for the faculty. At the undergraduate level, I think the summer programs, the research skills, the research internships, I will leave these with Dr. Belcher. There are a lot of ways that we can learn from this, but they're all common sense. If you're poor, you need money. If you're poor, you're less likely to have social capital across the board. Project Learn at Rutgers University, I think, is a wonderful model of training students from year one through the 4 years and then helping them to get into PhD programs where there was constant mentorship, there were individual research projects that they worked through throughout the 4 years, and they had the financial support. And again, we've had different types of programs. Are there McNair Scholar programs here? No? Okay, the McNair is the U.S. Department of Education, has been predominantly for underrepresented students, but also for other socially and economically disadvantaged students. The program is a wonderful idea. It depends on the institution. If the institution doesn't put in the resources and doesn't have the individuals who are committed and caring, and I think the problem we're experiencing now across the board and why we're seeing a tremendous decrease at the graduate and doctoral level for URMs and the faculty level is the lack of caring and committed people that are willing to make the investment. Now, I don't think institutions either should ask senior scholars to make investments with no compensation, because that's just not how we work here. So you have to be compensated to help people to get through their experiences. So this program pays for summer tuition. They pay for travel to academic conferences. They pay for academic advising. But it has not been as successful as it should be. So here again, where is the institutional responsiveness? Where is the institutional matching of resources? Where is the institutional understanding of the unique challenges that many of these individuals confront? And institutions have been non-responsive, and this goes across the board. So I hope that all of you begin to take a look at your institutions and where they could be more responsible and where they need to change. The other really important thing, and there's no question, this goes for the school systems, this goes for the college, this goes across the board. We need to have intergenerational approaches. This has to be in healthcare. This has to be in contraceptive teachings. Oftentimes the mothers of the girls don't know anything about contraception when you're poor and low income. So intergenerational approach is about education. It is about education. This is a wonderful, there are two programs. One's in California, which is a public housing unit. And what they do there is all the parents have to come to school in the evening, and they have to get a high school diploma. All the parents and their kids. So while the kids are doing homework, the parents are studying for the high school diploma. While the kids are learning computer, the parents are learning computer with them. So it's intergenerational transfer of knowledge. You can't have just that child learning if the parents doesn't learn, because what's going to happen? They're not going to be able to support that investment over time. So some of the studies that are done that children start out evenly in terms of middle class and lower income, like first grade, kindergarten, but they lose that within a year. Why? Because the parents haven't been brought into the process, and that's really important. So this intergenerational approach, it's an 8 to 10 week program. It benefits and siblings. I mean, if we have an 8-year-old and a 10-year-old and a 12-year-old, I think each of them, you can provide that investment, which will make your life easier in the long run. So this program graduated more than 33,000 parents and students. I think this is just wonderful. Now, we're getting to the end here. So what is the common, effective, and responsive elements of interventions? One is that they respond, and many of you have said this, they respond to the needs of that community. Now, responding to the needs of the community, you need to know the needs of the community. So for many of these institutions, they need to go out and get some basic demographics and needs assessment of this community. Because not every poor community needs the same thing either. So we need to know the needs of the community. We need to put out people who care about the needs of those communities, right? They have to care about the needs. So what we do know is that fellowships are not enough. We just can't give out the money and say, okay, you fend for yourself now. Caring and willingness to help are really important. We are now struggling with what do we do with faculty and mentoring? For example, assigned mentoring. You assign someone, and many of the faculty say, I'd never see him or her again. You know, you're getting Dr. Smith here. Dr. Smith really doesn't want to do it. What investment does this person have? So you have to be caring and willing to help. Again, recognizing diamonds in the rough versus those who are already at the top. And this is done over and over and over by every major institution. When you look at the data of URMs at the top 10 or top 20 schools, very few are URM. So that reminds me, so, you know, we love to talk about people of color. I mean, I think that's 80% of the world, because it's vague, and it covers up what we don't want to think about. I've talked about know the participant. I cannot say this enough. Know who your participant is. Know who your participant is. With respect to the work, and then work with the families as needed. We need bridging programs at every step of the way to strengthen the academic foundation and social capital. So I have developed a Intersectional Qualitative Research Methods Institute that I run every summer at Maryland, and it brings scholars from every field. I actually had 3 MDs and 2 nurses and other social scientists, to bring them into a community to not only talk about qualitative, intersectional, and mixed methods approaches to studying community and the lives of people in these communities, but equally important, helping them to navigate within the institutions, tenure and promotion, collaborative efforts, research, groupings, article writing, publication, etc. And what this has turned into really has been a bridging program to help them to transition when they are first-year faculty into second-year faculty, and second-year faculty into third-year faculty. They feel a sense of community. They feel like other people understand their work, other people contribute to them, and they are mentored by the faculty there to whom they can always return. So the bridging programs to strengthen those academic foundations and social capital is really important throughout the life course, I have a mentor too, and she's older than I am, and I go to her periodically because I still am stunned at institutional gymnastics that I really do not understand. Providing the psychosocial support is really important. Sometimes we just have to listen. We just have to listen that people feel, whoever they are, that they have been stepped on, that they have been dismissed, so that's important. And the research skills we talked about. So conclusions here, high school mentors and bridge programs matter. So college education is the magic key. And this whole book came out of 300 interviews that I did way back in the 1980s of Mexican American women. And one young woman said, my father took me out to the fields where he works one day, and it was hot. It was hot, and it was dry, and he said, unless you want to do this for the rest of your life, pick these tomatoes, you need to get the magic. And the magic key was her college education and her PhD. So that's why the book is called Magic Key. I think that improving Mexican American representation in college is a first step in reducing racial isolation and alleviating issues of unwelcoming climates. Now, for many of these individuals, Mexican American, African Americans, Native Americans, Puerto Ricans, if they go to Research One universities, they're still usually one of very few in the university. So we need to improve this representation in order to reduce isolation. Isolation is also clearly a way to eliminate people because you need social support. We need to increase students' financial literacy. There's no reason why students should not be taking loans also. So if they took more loans, they would more than would graduate from college. And we can say with much confidence that the educational policies in the United States have not promoted equity, and we need to increase that. I think the takeaway lessons is wealth and race mapped together to reinforce historic injustices. Those research experiences are critical. Intergenerational programs are critical. I wish that every hospital, every healthcare system would focus on families. We're doing this in cancer interventions. We do this in precision medicine. Why can't we do it for poor people? Families have to be part of that educational experience, and siblings, because doctors and nurses, this will help you in the long run when you see that family 2 years down the line, 3 years down the line. And let us stay focused. Every time I hear that we don't know what to do, I cringe. We know what to do. We have the models. We can move forward with this. Now, I think that Sonia Sotomayor, when she made this comment, it was very important, and we have to keep this in mind. She says equality, but she meant equity. We won't have an equal society. So until we get equal in education, we won't have an equal society. And she has tried to do a lot for education. Now, the last point I'm going to make is for all of you. We cannot do this alone. The underrepresented minorities are too poor, do not have wealth to make the change. So we need people like you. We cannot do it without you. And I love what Ms. Jemison said. She's an engineer. What you do with your place at the table. If you act just like everyone else, what difference does it make that you are there? So when you are at the table of the people with power, when you're at the table, even if you don't have power, you need to speak up for equity so that you too can make a difference. If each of us speaks up, maybe we will see change. Thank you.